Group.
Keep your family protected with our Family Medisure cover at an affordable rate. Our Seniors Golden Age cover is now more comfortable with Seniors Mediplan cover. And for 4 or more members and their families, Corp Care has you covered. CIC Insurance Group. We keep our word.
Good evening and welcome to Uliza Daktari, the show where we promise to answer all your questions on matters health and be sure to address things that will make you healthier and happier. Now, our sponsors on our show today and our partners are CIC Insurance. Now, CIC has a package that covers your entire family. CIC Medisure is there to make sure that you, your children are covered, and this is for your outpatient and inpatient needs through and through. Now, we have a CIC Seniors Plan. So this is for your parents or even for yourself if you're a senior above 60 to make sure that you enjoy your retirement with all your health benefits. Now, if you belong to a chama, a men's group or a women's group, then CIC has Corp Care Plan just for you to make sure that your medical bills are paid both in inpatient and outpatient services. Now, this evening, I am your host, Dr. Lauren Mengesa. I am a gynecologist and obstetrician. I'm based at the Nairobi Hospital and at Akira Care. And at Akira Care, CIC is also one of our partners, so when you come in to see us, then make sure that you are covered. Now, today we are going to be looking at chronic kidney disease. And to help us go through this topic is Daktari Kevin. Kevin, you're very welcome to the show.
Thank you so much.
Now, Dr. Kevin is a consultant physician and an interventional nephrologist. Yani shughuli zake ni za figo. He knows the kidneys in and out and is here to tell us just when to know when the alarm bells are ringing. But before we get into this very exciting discussions, we're going to be listening to George Thuo, who's going to talk to us about his journey with chronic kidney disease.
I remember back in 2019, I had some episodes with mental health. I first took pressure medications, then I stopped, I got healed, everything was fine, went back to work. But then sometime in 2021, during COVID or on around COVID, I started experiencing some mild headaches. Can't remember the exact genesis or when it began, but then I was assuming, because during COVID a lot was happening. Then sometime in 2022, I started noticing I'm having my headaches are becoming severe. So I was assuming maybe it's because I indulged. So I stopped indulging, especially on the drinking side. So sometimes I was chewing. So I was assuming maybe the chewing is what is contributing me to have headaches. So I kept taking medication, of course, over-the-counter medication without a doctor's prescription. This went on for some time. But then during some time at work, that was late 2022, I started having blurry vision. So when I went just to the sun to pick a call, coming back to my desk, I got a blurry vision. So I could see like I'm becoming a bit partially blind. So this triggered me. So I went to hospital. I went to an eye hospital. So by the time I got to the doctor was actually very angry with me, because the moment he looked at my eyes, he opened my eyes, he saw like I had dilated veins towards the eye. So he was very angry with me. He told me my pressure is very, very high. So he referred me to the clinic. That's when I went to the casualty. I was checked, given medication, told to come back after 2 weeks for review. But then during the 2 weeks period, I felt as if I'm getting worse. I could feel like I'm having muscle cramps. I'm feeling pain. So by the time I went back for review, I got some doctors, but also the nurses. I told them I was here, I've come for review, but I feel as if my pressure is too high. They took my blood tests and they did the test. But then they told me I'm fine. So, but they had to retain me to contain the pressure because the pressure was high. On my way home, I kept receiving a phone call, so I kept hanging up, but it was a continuous phone call, so I picked it up. I came to learn it was the doctor who had attended to me earlier. So she told me, it was a she told me, please come back to the hospital because there's something we really need to discuss urgently. So going back, that's when she broke the news to me. She told me, I think your kidneys are not working well, and you may need to see a kidney specialist. That's when I called my sister, we discussed. Then, yeah, that's when I decided to go to a different hospital for just a different opinion. Yeah, so when I went to the hospital, while I was getting the medication just to try and reduce my pressure and the pain in my head, that's when the doctors kept explaining to me my kidneys had really failed. They had really failed. They are stage 5. I didn't really have the symptoms as per se for kidney failure, apart from the fatigue bit, where I was feeling fatigued. It's like I've done a lot of exercise. And they also asked me if there is any history of kidney failure in my family. I told them no, none that I've heard of. The doctors told me just go home, but you have to take this pressure medication and come after 7 days as we keep monitoring the progress. So I didn't finish the 7 days. So on the 5th day, I started having the symptoms that the doctors were telling me, because I just gone out with friends, just going to chill, but this time I was very cautious. Then in the morning, I realized I'm trying to vomit, but there's nothing coming out of my body. So it's like an empty vomit. It's very painful, but nothing coming out, just gas, not even water. Rushed to hospital, they told me now, George, at this time now we'll have to start dialysis. That's the only way to get out of this, because I was not able to do anything. I could not do a number 1 or a number 2. I started dialysis, got admitted to hospital, stayed for around a week. And true to the doctor's word, I felt very well relieved. I do the dialysis 3 times a week. Till now, it's been almost now 3 years. Personally, I've been a bit unlucky with the donor, not gotten donor yet, because of 2. So first, non-compatibility, the others are disqualifications, and the others are, and the biggest one, it's the fear of the unknown.
Now, at Uliza Daktari, we are here to answer your questions. So please talk to us on our SMS lines at 22422. Our call line is down below. Engage us on our socials at Uliza Daktari and at Daktari_Mengesa. Now, so Daktari, leo tunataka kuzungumzia maneno ya chronic kidney disease. Lakini kabla hata hatujaanza pale, tungependa utuambie tu, what is the burden of this disease? How bad is it?
Ugonjwa sugu wa figo. Idadi ama takwimu ambazo tunajua ni kwamba dunia mzima kuna watu milioni 850 ambao wako na ugonjwa sugu wa figo. Bara letu la Afrika kuna kati ya milioni 100 na milioni 150. Na ukirudi hapa nyumbani Kenya, watu ambao tunadhani wako na ugonjwa sugu wa figo ni kama milioni 5.
Naam. Yeah. That's a very big burden. 5 million ni wengi kabisa.
Yeah, wengi kabisa. Yeah.
Naam. Kuna vitu ambavyo tunaweza sema ni risk factors ama viashiria ambazo zinaweza fanya mtu awe na chance ya kupata ugonjwa kama huu. Tumeona George akituambia kuhusu ugonjwa wa shinikizo la juu la damu, high blood pressure. Mambo yapi mengine yanaweza fanya mtu ajipate akiwa na chronic kidney disease?
Ya kwanza kabisa ni ugonjwa wa kisukari. Ikifuatiliwa na ugonjwa ambao George alianzia nao, shinikizo la damu. Sasa katika nchi yetu ya 3 ni fetma. Maambukizi ya figo ya ndani na pia maambukizi ambayo yanatoka sehemu zingine na inaathiri figo. Pia viungo vya mwili ambazo ziko karibu na kibofu cha mkojo. Kwa mfano ukipata saratani ya colon. Kwa wanaume kuna ile tezi dume. Ikinenepa ama ipate saratani pia inafungia ile kutotoka kwa mkojo ama ile njia ya mkojo ambayo pia inaathiri figo. Hizo ndizo za juu sana ambazo tunaziona. Lakini nyingine ambayo ningependa kusema ni ile utumizi wa dawa za maumivu ambazo ni za nguvu sana, zinasababisha figo pia kuathirika. Na kwa muda huu tunaona kwa ongezevu mwingi watu ambao wako na ugonjwa sugu wa figo ambao hauna sababu yoyote ambayo tunapata baada ya kufanya utafiti.
Kuna mtu ameketi pahali nyumbani anajiuliza hizi figo ni nini? Pengine tuanzie pale. What are these kidneys? Ziko wapi? Na kazi yake kwa mwili wetu ni nini haswa?
Figo kawaida naweza sema zinafanana na maharagwe. Upana wake ni kati ya 9 to 12 centimeters. Ziko nyuma ya mwili baada ya pale mbavu zipo. Na kwa hivyo ule usugu wa kuwa na ugonjwa wa sugu wa figo inamaanisha kwamba ile kukosa muundo hiyo figo vile inakaa kama maharagwe, ama utendakazi ambao unapungua na ambao unasababisha athari ya afya baada ya kupata shida yote ambayo inapunguza nguvu za figo. Yeah.
So inafanya nini? Kazi gani haswa hizi figo mwilini?
Figo kuna kazi mingi. Kazi ambayo ni ya juu zaidi ni ile kuweza kutoa uchafu wa chembe ambazo zinatengenezwa na mwili ambazo ni uchafu na kurudisha damu safi kwa mwili. Pia iko na jukumu ya kutengeneza chembe za damu ama hemoglobin. Pia kupatia mifupa nguvu, bone strength. Pia kuna uhusiano mkubwa kati ya roho na figo. Kwa hivyo wakati ule unapata figo imekosa nguvu, pia roho ama moyo unakosa nguvu. Kwa hivyo kuna baadhi ya jukumu mingi ambazo inafanya kwa mwili, si hizo tu ambazo nimezisema.
So figo ina maana kweli na umuhimu wa hali ya juu sana kwa mwili yetu. Naam. Wakati mtu ameanza kupata hii kidney disease, najua kuna ile ya haraka, ile tunaita acute, na kuna ile tunaita chronic. Kuna dalili, kuna viashiria ambavyo vinaweza kuambia jamani kuna tatizo ambalo limeanza kutokea na figo?
Ukweli kuna ugonjwa wa figo wa papo hapo, acute kidney injury. Nafikiria leo tunazungumzia ugonjwa sugu wa figo. Unfortunately, ugonjwa sugu wa figo ni ugonjwa wa kimya. We call it a silent disease. Kwa hivyo inamaanisha hakuna zile ishara na dalili za kuonyesha kwamba uko na ugonjwa wa figo. Na wagonjwa wetu kama George vile alikuwa tueleza, ni kwamba wengi wanakuja wakati wako katika jukwaa la 5, kwa sababu kuna jukwaa tofauti za ugonjwa wa figo, or different stages of kidney disease. Lakini it's a silent disease.
So ikifika zile late stages, ni nini watu tunaweza kuona kama madaktari kwa hawa wagonjwa?
In the late stages ama jukwaa la 5, unaweza pata mtu ambaye anatapika, uchovu wa mwili kwa sababu ya ile chembe ambazo ama uchafu zina accumulate in the body. Saa zingine roho unasikia kwamba unachoka haraka sana. Pia nguvu ya mwili, misuli, unasikia kwa misuli kuna shida. Mifupa pia inakuwa kidogo, unasikia uchungu ama kukosa ile nguvu ya kuweza kufanya kazi. Na sana ile tunapata zaidi ni watu ambao wanakuja wakiwa katika hiyo jukwaa la 5.
Okay. Daktari, can you tell us about urine ama mkojo? Kwa sababu hii ni kitu moja ambao watu wengi wakienda choo, unajua wamemaliza shughuli yao ni kuflash na kwenda. Lakini are we supposed to check our urine? And when we are checking, ni nini haswa tunaangalia? Kuna rangi tofauti pengine tunaona, na zinaashiria nini?
Mkojo inaweza tuambia dalili mingi sana kuhusu hali yetu ya afya. Na wakati ambapo unaenda msalani kukojoa, uone povu o frothing of the urine, inakueleza kwamba unapoteza chembe ndogo za protein. Na hiyo ni ishara kubwa ya kwamba unahitaji usaidizi ili uweze kujulikana ni nini inaendelea. Ule kubadilika kwa rangi pia inakueleza kama either you're dehydrated or overhydrated. Ni ishara pia. Saa nyingine pia unaweza pata mtu unapata mkojo uko ile Coca-Cola color, ambayo pia ni ishara ya kwamba tupa chembe ndogo za damu kwa mkojo.
Na je, mambo kama damu yakionekana kwa mkojo inaweza maanisha nini?
Sana ukianza kuona damu, kama ni tena lazima utofautishe kati ya mwanaume na mwanamke. Ukiona mwanaume sana atoa chembe, tena umri pia unakueleza. Inaweza kuwa ni ile saratani ya tezi dume ambayo tumeongelea. Lakini kwa ujumla ile kitu kubwa ambayo ukiona chembe ni maambukizi ya ndani ya figo ambao or infection of the kidney sana ndio inaweza sababisha upate blood in urine.
Naam. So please continue talking to us. Send us your questions on our SMS lines at 22422 and call us on the line below. Please engage us on our socials at Uliza Daktari and at Daktari_Mengesa. After the break, we're going to be looking at what is dialysis and what exactly happens on those chairs that we've seen on our promos. Welcome back. We're going to jump right into your questions. Now, anasema hapa, how many stages in the kidney transplant after getting a donor? Yani baadaye ukishapata donor wa kidney, what then follows? What are the steps? Mwingine anasema, if I have high B12 and low vitamin D, should I be worried about my kidney? And someone else is asking, what about when you have kidney stones?
Okay, I will start with the first one, which is stages involved in working up a patient ama mgonjwa ambaye sasa ako katika jukwaa la 5 in stage 5 or
in stage 5. Na pengine daktari, hata kabla tufike hapo, pengine tuguzie tu what are the treatment options? Ndio sasa tuingie pale kwa mambo ya dialysis. Unaona kama hivyo ni sawa?
So there are treatment options when your kidneys are at stage 5. We talk about renal replacement therapy. So in renal replacement therapy, there are different things that happen. One of the options, and which is immediate because it's an emergency. Remember, we just talked about removing waste products and toxins.
So and they're now accumulating.
They're accumulating,
body,
so you can't wait. And getting a donor, as you have just heard George talking about, is such a huge task. So one of the options is dialysis, and there are 2 types of dialysis. There is hemodialysis, and I think that's what George is undergoing, and there is peritoneal dialysis. The other thing is you can have now transplantation, and that's the definitive treatment for a patient who is in stage 5 of chronic kidney disease. Okay,
let's take a call from Mandera, then we come back to you. Daktari, hello.
Yes, Alenga.
Mzuri sana, karibu Uliza Daktari.
Nilikuwa nimeuliza daktari.
Naam.
Hello?
Yes.
Mimi naitwa Mohamed kutoka Mandera County. Nilikuwa na almost 3 to 4 months nilikuwa nikikojoa, alafu ninakuta kwamba mkojo wangu inakuwa yellow, zingine inakuwa white, zingine nyingi inakuwa yellow, almost 3 months to 4 months.
Swali lako?
Almost 3 months to 4 months.
Ni kama tumsikii vizuri kwa sasa. Let's go back to dialysis. Sasa ulikuwa unatuambia kuna aina mbili, hemodialysis na peritoneal dialysis.
And what is common in our country is hemodialysis, but peritoneal dialysis is also an option. But especially in a young person like George, if you look at his quality of life, then the best treatment is usually doing a transplantation. And there are different types of transplantation. There's both a preemptive transplantation and transplantation itself. So it means even before you go to dialysis, you can have a transplantation, or you can have transplantation once you've initiated dialysis. But those are the treatment options that are available for someone who has stage 5 kidney disease, and not the other stages.
We want you to just maybe paint a picture for us. Hii dialysis, what is happening? Manake we see people, they're seated on their reclined chairs, and we're seeing, machines connected to them. There's blood coming out. So what are we doing? What are these machines doing? What are they achieving?
So dialysis is treatment option that involves removing blood and taking it through a machine. So the machine that you see is actually functioning as an artificial kidney. So it removes all the waste products and all the different small elements and balances them out as they ought to be. And then returning now purified blood back to the body.
So it filters, it does the filtration process that the kidney would do.
Would normally do. And this is done 2 to 3 times a week to ensure that you have good quality of health.
Okay, we have a call from Nairobi. Hello.
Hello.
Hello, karibu Uliza Daktari Joseph.
Yes, habari yako?
Mzuri sana, swali lako?
Swali langu lilikuwa ninakojoa sana. Nakojoa mkojo ambayo ni wa yellow zaidi. Na ni kila wakati nakojoa hiyo mkojo, so huwa nashindwa ni shida ni gani, alafu nakuwa na ile muwasho wa kujikuna tena kwenye sehemu zangu huko.
Asante sana Joseph, tutarejelea swali lako. Okay, so tumeongelea mambo ya dialysis na there's been a lot of these questions about rangi ya mkojo na inaashiria nini. Kama Joseph anasema haya, akiona hii mkojo imebadilika rangi na kukojoa kwa mara mingi zaidi, what can it mean?
George na mwenzake ambaye alikuwa amepiga simu kutoka Mandera, rangi ya mkojo yaweza kueleza vitu mingi sana. Na ule mtu alikuwa amepiga simu from Mandera, that area is very warm. Kwa hivyo you tend to get very dehydrated. And if you are dehydrated, your urine color will change. Na kitu kingine ambayo pia ulikuwa umeashiria hapo mbele is about kidney stones. Kwa hivyo watu ambao wako in our northern arid areas tend to get kidney stones. Na inatokana na hiyo ambayo ni kutokunywa maji ya kutosha. Na kwa hivyo inaruhusu the formation of stones.
Maji ya kutosha ni nini daktari? How many liters a day?
Hilo swali njema sana. Maji ya kutosha ni ile what you feel, how thirsty you are or how much you feel your thirst has been satisfied. People talk about 6 glasses a day, but remember people are different. And so there is not one particular limit of how much water you should take. But as long as you feel thirsty, you have to take the water. So there is no absolute number of how much adequate water you should take.
Okay. Yeah. So you've just talked to us about dialysis. Hey, dialysis tukishaianza, is it permanent? How long should someone expect to be on dialysis once they start?
Very good question. Once you start dialysis, remember your kidneys are not functioning. Once you're in stage 5, it means you've lost all functions of your kidney. And therefore, the machine takes over those functions. And remember, the most important function is removal of your waste products. And if they accumulate, then mortality is high. So therefore, dialysis is a continuous process unless you undergo transplantation. Transplantation is ndio matibabu ya mwisho ya mwafaka kwa mtu ambaye ako katika jukwaa la 5 la kudhoofika kwa figo.
Tuna maswali yetu hapa ambayo tunapenda kuzingatia kidogo. Naam. So our first question is, I have been on dialysis for the past 10 years and I'm having painful left hip joint and my PTH ikiwa parathyroid hormone is high. What's the best remedy to control high parathyroid hormone? Tuna simu pia. Hello. Tutarejelea pale. Next question anasema, my friend had 1 kidney removed after failure and is on HCTZ, that's hydrochlorothiazide tablets, despite her controlled BPs, which most of the time BP iko chini. What role does it play? So huyu anataka kujua mambo ya kidneys na shinikizo la damu yanapatania wapi. Anasema huyu anaitwa Allison, my son is 4 years old. Last month he was diagnosed with nephrotic syndrome, which daktari told us is very common. We've been on medication and checkups, no protein seen. Should I be worried? So pengine tuzungumzie what do you recommend to use or to do to avoid chronic kidney disease? So pengine tuanzie pale kwa nephrotic syndrome, turejelee kwa dialysis na turudi kwa transplant baadaye.
So nephrotic syndrome is actually very common and especially in young children. Unapata kwamba ukiangalia mkojo kuna zile chembe za protein zinatoka kwa mkojo. Kidney, the way to look at it is like a sieve. And when your sieve has some small holes and you start leaking things in urine. So nephrotic syndrome once diagnosed, na ile kuweza kuitambua lazima ufanye utafiti maalum kwa maabara, doing a kidney biopsy and identifying what type of nephrotic syndrome you could probably be having. Baada hapo unaanza matibabu mwafaka kuhakikisha kwamba haupotezi hizi chembe. Kumbuka chembe za protein ziko na muhimu. Umuhimu wake starts from your immune system to even your cardiovascular and renal health. Kwa hivyo ni muhimu ambao uweze kuzuilia kupoteza hizo chembe za proteini.
Kidogo tuna simu kutoka Vihiga. Hello.
Yes, hello, mimi naitwa Patrick.
Patrick, karibu Uliza Daktari.
Nasema nilienda hospitali nikaambiwa kwamba na shida na kidney. Kaniambia kuna vitu zinamea kwa kidney zangu zinaitwa cysts. Sasa ndio nilikuwa nauliza, wakati nienda huko wakaniambia nitumie, nikapewa dawa tembe ambazo zinaitwa Eversafe. Sasa sijui hiyo ni za kutuliza tu ama inaweza kunisaidia kidney zangu zipone, ama ninaweza fanya namna gani? Naweza chukua hatua gani nyingine ili nikaweza kupona?
Una umri
Ingawaje
gani?
shida nyingine yoyote sina, mkojo iko tu sawa. Nguvu niko tu nayo kama kawaida.
Naam, una umri gani tafadhali?
Niko na miaka 51.
Asante sana Patrick, and all other viewers, we're going to get back to your question just after the break, so don't touch that dial.
All eyes on me.
View sasa ndio nyumbani kwa the best local dramas.
Nataka ripoti ya Hansi pamoja na mkewe.
Now, Patrick, I hope you're still tuned. Now, you asked us about cysts in your kidney, and we have another few questions that tie in. Kuna mtu anasema, Daktari, my sister has an enlarged kidney. What is the reason? Hello, I'm William from Umoja, having a patient whose kidney is enlarged to 21 centimeters. Is there a cure? And he's having blood in his stool. He's 78 years old. And there was also another question asking about, is kidney disease something that you can inherit from your parents?
So there's a genetic influence to kidney disease. So there's a possibility of inheriting kidney disease. Good example is what we were talking about, like the patient who says they have 21 centimeters in size. Remember, I started talking that the kidney is like it's bean shaped. It's about 9 to 12 centimeters. So when you do a radiological investigation and you find it's large, then you're having a problem. So what are cysts? Cysts are like small balls in the kidneys that are filled with water. And normally you can have a few of them, but depending on the age and the number, then they can tell you whether you're having something we call polycystic kidney disease. And this needs to be really followed up by someone who is specialized in this area, and these are the nephrologists together with the urologists, in order to get the treatment that one deserves.
Okay,
Yeah.
so we have a call from Nairobi. Hello. The call has dropped. Okay. Daktari, kuna swali hapa anasema, do people who have HIV, do they stand a higher risk of getting kidney disease? And someone else has asked about antacids and their relationship with kidney disease.
Yeah, in our continent, infection is actually among the leading risk factors for chronic kidney disease. So HIV itself, because of the infection, together with the medications that are used for treatment, there is a higher risk of getting chronic kidney disease. Antacids, especially esomeprazole, is associated with chronic kidney disease. But more importantly, and I need to emphasize this, over-the-counter pain medication, and especially this maramojas, the diclofenac. Sometimes we just find the only reason that someone has chronic kidney disease is just the use of chronic NSAIDs, as we call them. Remember, the elderly people tend to have joint pains, and whenever they get back pains, or even just normal headache, and you're routinely just using painkillers, that can be the only risk factor, and not even having diabetes or hypertension for chronic kidney disease.
Okay. Daktari, please talk to us about hizi stages za kidney disease and a bit more about this transplant. Na kuna watu wanawasiwasi wanasema, jamani, hiyo kidney moja ikishaenda, what happens to the person remaining with the one kidney?
Okay, yeah, there are 5 stages of chronic kidney disease, and the staging is done once you've done your laboratory investigations. But more importantly, beyond the lab, it's important to look at urine. And when you identify the urine, you're looking for proteins, because you might be in stage 1 of chronic kidney disease, but you're leaking a lot of protein. That alone can make your progression of chronic kidney disease faster to stage 5. From stage 3, we tend to follow up, and they should be followed up by a specialist, so that you can institute a treatment that can help you retard the progression of chronic disease and also the complications that are associated with chronic kidney disease. In terms of transplant, they're different depending on the institution. In our country, I think we now have 7 or 8 centers that are doing transplantation. You have the protocols or njia ambazo zinaangaliwa kabla ya mgonjwa kufanyiwa the transplant. So they are about, in most centers you have 6 stages stages of evaluating someone who is donating. And I have to say, we are always proud of people who donate, because it's not easy to donate an organ. In this country, we have a living-related donor program, meaning kumaanisha kwamba watu ambao wako na uhusiano ndio wanaruhusiwa na sheria na kanuni za nchi kuweza kupatiana viungo vya mwili. So once you have identified a donor, stage 1 just involves having a thorough checkup to see whether you can be a suitable candidate. And we follow them in a structured way. And if the donor at any one stage we think, for example, you're likely to develop diabetes in the next 5 years, we drop you off, because we are really interested in the health care of the person who is donating, so that once you remain with that one kidney, you will live a normal life. And so to answer something else that many people tend to fear, is that you can comfortably live with one kidney, and that's why we have 2 kidneys. And so even the people who donate, we tend to follow them after transplantation, and the outcomes are usually good.
Okay.
Yeah.
Now, Daktari, of course, everyone is asking, what can we do to prevent hii chronic kidney disease? Mwingine amesema, Daktari, what is the perfect diet that I can take? So ni mambo gani tunaweza zingatia ili tusifike hapa kwa kuhitaji transplant ama dialysis?
There are a lot of things that we can do, but chronic kidney disease is it's a lifestyle disease. It's an uncommunicable disease. Top of the list of the things that one can do is nutritional adherence to a diet. First, we are always very keen on telling our patient to stop taking salt or having a low sodium diet. The other thing is a low carbohydrate diet. Number 2 is doing physical activities. And again, this can be structured, because what a 70-year-old can do, a 50-year-old or a 20-year-old is so different. But it's important to take that walk at least 3 times a week, so that you can also give your body some rest. The other thing, obviously, I cannot overemphasize avoiding taking over-the-counter medication, and especially strong painkillers. Then remember, chronic kidney disease is a result of other diseases that tend to have an impact on the kidney. So if it's your hypertension, ensuring that your blood sugar are well controlled, if your blood pressure is well controlled. If it's diabetes, ensuring that your sugar control is well. The other things that we are keen on is having a routine annual evaluation, so that we are able to stage you and see where you are and put you on treatment that is right, and that will tend to retard the progression of chronic kidney disease. So lifestyle is really important. Control of the diseases. For example, if you have polycystic kidney disease, saizi kuna matibabu ambayo inaweza saidia ugonjwa kuendelea zaidi. So it's always important to be followed up by a specialist who has knowledge in chronic kidney disease.
Okay, sawa sawa. So any parting shots for us as we close, Daktari?
First is to thank you and Citizen TV for the work that you do, kuhakikisha kwamba mnaleta audiences together with specialists in different fields. In terms of chronic kidney disease, it's a growing burden. We're talking about 5 million people, and only 10% have been identified and put in healthcare system. So there is a huge task ahead of us to identify the other patients and put them in healthcare system. More importantly is to have a routine annual evaluation or medical checkup, early identification, putting these people in healthcare system and starting them on medications that will retard the progression of chronic kidney disease. So for me is to ask people, go out there, do your blood pressure measurement, do your random blood sugar, do your annual checkup, so that we can try and mop up a lot of people with chronic kidney disease and hopefully retard this pandemic that is coming up in the near future.
Thank you so much, Dr. Kevin, for being with us this evening. You have indeed been such a gracious guest to us. Naam, so umeelezea maneno ya figo na ni vipi ambavyo tunaweza jikinga dhidi ya magonjwa ya figo, and also how to know wakati kuna shida na kidneys and when to see a doctor. Now, our partners on this show was CIC Insurance. Now, CIC have for you a CIC Family Medisure plan. They have a CIC Seniors plan as well as a CIC Corporate follow-up care plan that should be able to cater for all your needs. Now, I've been your host, Dr. Lauren Mengesa, an obstetrician and gynecologist, like Dr. Iwetu Kevin, who is based at the Parklands Kidney Center. Both centers partner with CIC, so if you're covered by CIC, you can have a pleasure of meeting us. Now, thank you for joining us on this show. See you again next Sunday as we answer your questions on all matters health.